What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering morning reports as an X-ray tech at the hospital. What to expect. So I am a night shift X-ray tech, been doing it for over 4 years now. Trauma 3 ER in the great state of Texas. So morning reports are this little bundle of joy that a night shift X-ray tech gets to do. So it's essentially a work order list that people who have been admitted, maybe they need a chest x-ray, maybe they need a KUB, foot, whatever these doctors / residents order. They come in around midnight, mine specifically 12:30. And essentially it's exams that have to happen between midnight and about 5 a.m.-ish. Anything after that, they will start calling and ask where my picture's at. So technically you want to do it before that. These can range from, I've done C-spines like post-op for their neck. I've done just a full KUB. I've done mainly chest is the main thing you get involved with. Mainly one view, sometimes two views if you're doing like for pacemakers and stuff like that. And then baby grams at the NICU, any x-rays over there too, which the babies are more picky when they want theirs. Maybe it's just my hospital. They want them around 5. I guess it's before shift change and stuff like that. Certain floors are more easier to, as far as to gauge and when to go to them, because throughout the night, certain floors of the hospitals will be doing the rounds, and essentially what happens is you'll go at certain times, and every single room you go into, there will be a nurse in there doing whatever nurses do overnight, patient care, medicine, whatever. So we, at my hospital, we found at 2 a.m., because there's two sides of my hospital. There's like a west side and an east side. The west side is like for the more intense patients who are more severe with the ICU and the other ones. And the other sides are like cardiology and spines and like less severe patients. Usually they start on the west side and then they end up on the east side and then they go home. Technically, that's what I've noticed. But anyways, we'll do the 2 and 4 o'clock. If we get busy behind, we'll push it to 3 and 5 o'clock. As far as the runs, usually the runs can vary. I mean, there's times where you look at the list and it will be, I think the lowest I've gotten was 5. The most I've had to do was, I want to say 40 or 50 during the winter months. It definitely gets busy during the winter months. What else? Let's see. Just be aware that when you go at these ungodly hours, you will be pissing off a bunch of people. You will be cussed at, yelled at. You will be told by nurses, "Why are you doing it this early? My patient can't sleep," or patients can't sleep, and they'll complain, and you'll hear everything in the books. Now, depending on what's going on and what floor you're on, you may be able to avoid certain morning parts because the nurse or whoever will tell you to wait, or the patient will cuss you out and tell you no, and you're like, well, he didn't say he didn't want it, he just didn't want it right now. So you have to kind of pick your battles as far as, when you hold back on not doing it. Like if they're in like the ICU, most of the time they're intubated. To me personally, I love shooting people in the ICU. It's the easiest ones. Most people are intubated. They're on propofol, in and out. They're our number one customer. The patients don't say anything. They're just there. You can do your job. It's the easiest one for me personally. Other people get anxiety going up there because patients have a lot of stuff going on and they're not the easiest. And then on the opposite side of our hospital, it's more of the people who are awake. Maybe they had something with cardiology, and those are the ones that we try to go later, because if you go too soon, they get a little mad at you for that. But that's part of the job. If you work night shift and you go do that, be prepared, to terrorize people at night. Let's see. Certain floors of our hospital, if we go too early, get mad at us, even though we've told them our situation. So you can kind of pick your battles of how you deal with your morning ports, but the point is, as long as it get done, to me, that's literally what matters. Because sometimes you get called early. Like if I get called to the floor and it's like 12:20, you best believe I'm gonna wait till that morning port spawns in, and I'm gonna just look and see all the x-rays I gotta do on whatever floor, or move them all over, and just to be working more efficiently. Because sometimes going to the floor to do your little list is really, really hard, because you're slammed with the emergency room, or you're running all over the hospital and you get caught up and it's chaotic. So, because there's times where literally nothing happens in the emergency room and you'll be chilling. You're like, dang, we could have gone to done all this, but we were just chilling. So it all kind of varies. Certain places and certain doctors are more chill with the ER. They know, especially ours, since we're pretty consistent on the times we go with, if they order something, they're pretty chill to back off. Unless the patient's like really dying and they need it now, they'll kind of, wait till we come back from our little runs to knock it out. Within reason. I mean, we always have the little thing on the board at work on all the patients that literally says we have like 30 to 45 minutes to get their exam done. So, there's always that. Most of the time they do a pretty good job of putting in the orders. Certain floors are more notorious to add on or tell you as you're going, or they won't tell you until you come back to the department and you look at the orders, like to the computer, you'll see that they added more. Residents are notorious for doing that. Thankfully for me, I have a little thing on my phone where I can see the orders, and you can kind of, tell what's going on. Or if we're doing morning ports and we see someone who's intubated or has a chest tube, for sure those two, they're gonna need an x-ray. So we'll talk to the nurse or whoever is working with them, and most likely you'll have to do it. It's just working smarter. You would hope you wouldn't have to do it, but especially a chest tube, they shoot those every single day. You're gonna get dragged back to, might as well knock it out. I'm just saving you a trip on that one. Certain patients, if they're organ donors, you will have to shoot them multiple times, sometimes twice, depending on how often they, check their thing. I know certain places, they have like a time window when that stuff has to be done. So you have to kind of, like, you can't delay it to certain hours because of, it's an organ donation type of deal. Once again, the most of all those are routine. Now, if I see something that seems maybe like a pneumo, or a patient, like when I'm putting it online, their condition of the image, like as far as like they had a lung and now they don't have a lung, or it looks really bad, I'll switch it to like stat so it gets read overnight. If it's routine at our hospital, it won't get read. So sometimes I'll see something and you're like, let me put a report on it, and, order a stat or change it so it gets read. Because the worst thing that can happen is a patient maybe he had a pneumo, or maybe he had worsening condition, and then they're like, why didn't it get read? We had a situation at our job where a patient fell. We shot some x-rays on him, and apparently something was broken, and we didn't change it to stat. It was on the floor, and like the patient like the image didn't get read till the daytime radiologist showed up till 6. Nothing happened. They just brought to our attention, I guess the nurse was like, yo, if it's a fall or if it's this and that, you got to change it to this. And then we're like, cool. So we always try to be, if you're not sure, if you see something or you think something's off, or like the patient, just if you're able to change it and put it to where it can get a report just to make it easier and cover you, would recommend. Save you having a little chit chat with upper management. But for the most part, the people you shoot them, like especially if they have a chest tube, you'll shoot them almost every single day. And you can kind of already get a feel as soon as, like right now it's night 1 for me. I can already kind of know how much we're working with. Usually at the beginning of my 7, our workload is like more heavy, and then so they slowly get discharged or they don't need X-ray. So by the time night 7 comes, our morning report list is like pretty small and it'll be easier. It's just literally, it all depends. I mean, I've worked on the opposite shift and it's complete opposite for them. They start off with like a low list and then they end up with a big list. So, I mean, it's all random. I mean, sometimes you have extra add-ons around like 5, 6, which those kind of still fall into our responsibility unless like we're like slammed in the emergency room. Because then day shift will come in and be like, yo, why didn't this get done? A 6 a.m. timestamp. And depending on who you work with, it cause problems. So, hope that helps. My boy, you can check out the rest of my channel. I post educational videos on this beautiful world of radiology. And if you want some memes, just link below. And we'll see you on the next one.